One of the biggest questions we get is whether a pharmacist in Ontario can provide point-of-care testing. In Ontario, a pharmacist can use Lancet-type devices to obtain blood from a patient for 3 reasons: for a patient's education, for a patient's self-care, or for a patient's monitoring of his or her chronic disease. This can also be done by a technician, an intern, or pharmacy student under the supervision of a Part A pharmacist. The purpose of the regulation is mostly for teaching. For example, a pharmacist can use a Lancet to teach a patient how to obtain blood to use a blood glucose monitor. A pharmacist could also use a Lancet-type device to obtain blood to help the patient monitor their own hemoglobin A1C or INR, for example, on a pharmacy-owned device. The regulations are less clear about whether a pharmacist can monitor a patient's chronic disease with point-of-care testing. For example, if a pharmacist is operating an INR clinic and using point-of-care testing to monitor warfarin therapy, this could actually fall outside the regulations, as the pharmacist is not performing the test for the patient's own self-monitoring. In this case, a medical directive may be needed from a physician or nurse practitioner. If you are offering point-of-care testing, here are 3 things to remember. The first is that to offer point-of-care testing with a Lancet-type device, the pharmacist must explain the purpose of the testing to the patient or agent and obtain informed consent. Consent cannot be implied. The second is that the pharmacist cannot use the information to make a diagnosis, since the act of diagnosing is not within the scope of practice. And the third is that the demonstration area needs to be clean, private, and comfortable for patients. Finally, the fourth is that the pharmacist needs to write down the patient's name, address, consent, results, date, and who performed the procedure.